Born on October 3, 1804, in Mobile, Alabama, William Crawford Gorgas entered a world of warm Gulf breezes, bustling ports, and the intricate rhythms of a city. Still recovering from the sectional conflicts that had scarred the South, the son of Josiah Gorgas, the distinguished Confederate officer and later University of Alabama president, William grew up in a household steeped in discipline, intellect, and public service. His early years were filled with books, discussions of science and governance, and the quiet insistence that knowledge was both a privilege and a responsibility. Gorgas pursued medicine, enrolling at the University of Alabama before continuing at the College of Physicians and Surgeons in New York. There he specialized in public health and sanitation fields still in their infancy in the United States. His early medical career was characterized by curiosity, meticulous observation, and a growing interest in the invisible agents of disease, bacteria, mosquitoes, and the environmental conditions that nurtured them. Gorgas was particularly drawn to tropical medicine, fascinated by the challenges posed by yellow fever, malaria, and other deadly epidemics. His career took a decisive turn in the 1890s when he was appointed U.S. Army physician specializing in tropical diseases. At the time, yellow fever devastated cities like Havana, Cuba, and the cause remained poorly understood. Drawing on the groundbreaking research of Dr. Walter Reed, Gorgas implemented mosquito control programs, draining standing water, fumigating homes, and isolating patients. The transformation of Havana from a city plagued by epidemic to one of remarkable public health success marked Gorgas as a pioneer. His methods demonstrated that careful sanitation and scientific rigor could save lives, turning the tide against diseases that had terrorized populations for centuries. In 1904, Gorgas was appointed Chief Sanitary Officer for the Panama Canal Zone, a challenge perhaps unmatched in its scale and complexity. The canal project, vital for international trade and U.S. strategic interest, had been plagued by disease, killing thousands of workers annually. Gorgas brought the lessons of Havana to Panama with relentless energy. He implemented strict mosquito control, overhauled drainage systems, enforced quarantine protocols, and educated workers and local residents on sanitation practice. Under his guidance, deaths from yellow fever fell to nearly zero, and malaria was drastically reduced. His work allowed the completion of the canal, a feat of engineering and medicine combined, securing his place in global history. Gorgas' accomplishments were not merely technical. They reflected vision, leadership, and the ability to coordinate vast teams under extreme conditions. He supervised thousands of workers, navigated political and cultural challenges, and persuaded skeptical administrators to embrace scientific solutions. His correspondence reveals a man both tireless and neglected, deeply aware of the human cost of disease and the importance of prevention over cure. national fame, Gorgas remained connected to Alabama. He visited the state regularly, speaking at medical schools, mentoring young physicians and advocating for public health reforms. His work inspired generations of doctors and public officials, establishing standards that would become the backbone of modern tropical medicine and epidemiology. William H. Gorgas died on February 6, 1920, in Washington, D.C., after a life that transformed both cities and continents. His legacy endures not only in the successful completion of the Panama Canal and the lives saved in Cuba and Panama, but also in the broader understanding that public health, sanitation, and scientific diligence are indispensable to human progress. Remembered as a son who carried the state's ideals of service, education and ambition to the world stage. From Mobile's sunlit streets to tropical battlefields against disease, his life exemplifies intellect applied in service of humanity. Through his vision, courage, and meticulous execution, William H. Gorgas left a mark that transcends geography, a testament to how one Alabamian's dedication can save countless lives and shape the course of history.